Okay, Lindsay Bond, epidemiologist for the city of Nashua. First, I'm going to speak on COVID and our numbers in New Hampshire and in Nashua. And then I will cover just a quick monkeypox update. So, for COVID in New Hampshire, the total cases since the beginning of the pandemic has been 340,378 cumulative cases. And as far as new cases go, there was 147 new cases reported as of yesterday. There are 118 individuals in the hospital with COVID-19, and 20 of those are being treated with antiviral medications. In the state of New Hampshire, there has been 2,636 cumulative deaths since the beginning of the pandemic. For Nashua numbers, total cases has been 24,187. New cases for yesterday reported was just 7 new cases, and cumulative deaths since the beginning of the pandemic has been 157. As far as CDC community levels, this is a new metric that has been used by the CDC probably within the past 4 or 5 months, discussing on certain guidance based on new COVID-19 admissions over the past 7 days and percent staffed inpatient beds occupied by COVID-19 patients on a 7-day average. This is based on county level. So for Hillsborough County, we are now at a low community level. For guidance, it's stay up to date with your COVID-19 vaccinations and get tested if you have symptoms. You can still choose to wear a mask. If you have symptoms and a positive test, make sure to isolate and wear a mask. And as far as monkeypox goes, I know we had missed last month's meeting, so a lot has happened since then. There was a lot of information in this packet. I'm just going to do highlights for now. As far as global cases go, there's been a cumulative case count of 31,800 cases since the beginning of this most recent outbreak. For non-endemic countries, so countries where this typically isn't found, there has been 31,425 cases, and that's affected 82 countries. For endemic countries, which is where this disease typically is found, there's been 7 countries with a total of 375 cases. For the US, there's been a cumulative case count of 9,492 since the beginning of the most recent outbreak. The only state that has not been affected is Wyoming. In New Hampshire, there has been a total of 15 cases. As of right now, they are not reporting by county or town because the case count is too small and could be considered identifiable. There is some wording about background transmission and symptoms. As it is known now, lesions are the most common symptom and are the source of infection. So guidance for isolation: if someone has the lesions, they have to wait until they are completely healed and new skin is formed in order to end isolation and not infect anyone else. For the latest news, there has been quite a few updates on vaccination. So for Vaccination Strategy, it's the Jynneos vaccine. It's the vaccine that prevents orthopox, so that of smallpox and monkeypox. It's a 2-dose regimen that's given 4 weeks apart. There are different strategies in place based on case count per state. So for PEP, which is post-exposure prophylaxis, it is a vaccine that's given to individuals that were in a high-risk situation, so skin-to-skin contact of someone that was tested positive for monkeypox. This could also be household contacts where maybe linens are shared or they're sharing a bathroom. For pre-exposure prophylaxis, this is something that's being used in states where there's really high case counts, such as New York. And then I know cities like Chicago, too, they're also doing this strategy where it's given to individuals before there's a chance of exposure that are considered high risk. Eventually, we will move to the strategy. We're not quite there yet in New Hampshire. So I also wanted to give an update. As of yesterday, the FDA provided an emergency use authorization for a dose-sparing strategy so we can get more doses to more people, and hopefully PrEP can get started sooner rather than later. So the strategy is, instead of giving 2 whole doses to one person, 4 weeks spaced out, it would be splitting 1 dose into fifths, still giving 2 doses, and instead of being administered subcutaneously, it would be intradermal, so deeper into the tissue. And it has been found within clinical trials that this is equally as effective. So in this case, 1 person would still receive 2 doses. It would just be a much smaller dose compared to what we're getting now. Another emergency use authorization that was announced yesterday is that the Jynneos will be provided to those under the age of 18. Prior to this, it was not approved to be given to anyone under the age of 18, but as we've seen, household contacts that do happen to be under the age of 18 are able to receive this and prevent infection. And that is all I have. Do you have any questions?
Thank you, Lindsay. Is there any questions?
Oh, thank you. Thank you for the update. I do have a question. If someone wants a vaccination on the monkeypox, do they go to the health department or do they go to their own PCP?
So Kim, our Chief Public Health Nurse, will actually answer this question.
No, it's not working.
I think now. Okay.
Okay.
I want to follow the directions and use this properly. So, hi, good morning. I'm Kim Bernard. I'm the Chief Public Health Nurse. And basically, right now, we are able to administer the PEP, which is the post-exposure prophylaxis, and that is for high-risk individuals that are contacts to positive case of monkeypox. With these individuals at the health department here in Nashua, we're able to administer this to clients that are in the greater Nashua area that are underinsured or uninsured. If there was a case that was known out that doesn't meet that criteria, what would happen is the person would want to go call their PCP, and the PCP would reach out to the state, and they would then direct them to where they could get the vaccine. Right now, the state is working on compiling the different sites throughout the state, and that will be on the DHHS website. They're working on that right now. So that should be coming out very shortly. As far as PrEP goes, which is the pre-exposure prophylaxis, that vaccine right now, it's the same vaccine, it's just used in a different manner. That will be available soon. Like Lindsay said, we just got the EUA last evening. So what we're doing right now is if it's someone that is requesting it in our area, we're taking a wait list, so they could give us a call at the health department, and we can add them to that waiting list and give them a call when we start scheduling appointments.
Can I have a follow-up question, please? Once a person feel or notice lesions, do they immediately get the vaccination, or what is the process?
So we would be vaccinating prior to that. So the vaccination is to prevent the disease. So if someone was a close contact, then we would, and they were high risk, then we could administer the post-exposure vaccine. The pre-exposure would be just someone that may not have been exposed, but may be high risk for exposure. So then we would administer that to that individual.
Just one other follow-up on that one. So therefore, it's too late if someone is already exposed.
If you do have the lesions and you're positive for monkeypox, then yes, you wouldn't get the vaccine at that point. There is treatment that is going to be rolling out as well, so there'll be more to come on that.
Thanks, Stephanie.
A comment and a question. First of all, kudos to the department for being able to give a situational update on what was happening last night nationally. It just shows, A, the challenge of the work of this department, but also the commitment, so thank you for that. We are very connected to our university, our schools, as well as to the food industry. What will we be doing in the next month, either based on what's recommended by the state epidemiologist or our own knowledge from communing with other public health departments about what the university should do to keep students safe, since they'll be in communal settings, and what other types of precautions that our food providers might undertake, our nursing homes and such, so that transmission by fomite would be diminished or eliminated. You can answer that later in your report, but at some point I'd like to get your take on it.
Sure.
So there has been some discussion about communal living. It just hasn't really developed all that much yet. I'm sure it's because the school year hasn't started yet, and there's so much information coming out day by day. I'm sure within the next few weeks there will be some sort of strategy in place, and there also hasn't been much guidance as far as food handling goes.
I just, a follow-up comment.
Mhm.
It's very alarming to me, because what we said is COVID got out in front of us, and there will be other pandemics, and I realize this is not a pandemic, but we went from it's not a concern to a global health emergency pretty quickly. And it would seem to me that in the absence of national guidance, and given the incredible skills of communication and messaging of this department, that something should be going to, RIV and, our other colleges in advance of the kids starting school about what they need to be aware of, as well as to the food industry, because if we have situations where, it can be transmitted on linens and so forth, that also could be, non-disposable tablecloths and so forth.
Right. So some of the communication that's going on right now, we're working very closely with DHHS.
Okay.
They are working on scripting currently that will be passed along to the local health departments. We will then in turn be able to tweak that scripting and push that out to our partners. So although we don't have a specific plan right now, we're working on that. And I had one more thought, and I'm trying to remember what it was.
That there's a HON that will be coming
Yes.
out later today. So the health alert will be coming out from the state with a great deal of information. They did let us know this morning that it is going to be very long. So you'll probably get it, Chuck, over at Dartmouth, as well as many of our other healthcare
Yes.
providers that receive that information. And then what our team will do is the information that comes out of that HON, we'll take some of that and that will be pushed out in some of that information.
Great.
As you mentioned, it is, because of what we've already experienced with COVID, we would think that we would be, as a state, a little ahead of the game, because an infectious disease is an infectious disease. And processes and getting information out should sort of be standard. What we want to do is, again, work with our state, push out the information so that we're all pushing out the same information. So our only delay is in making sure that whatever we push out is aligned with what the state is pushing out. And so that's going to come from that health alert that's going to go out this afternoon.
Great, that's great.
Yes,
information.
and we're just trying to, it's just so fluid that we just want to make sure that we put out, I know with COVID, there's a lot of changes on a daily basis. So we want to make sure that we put out the most current, most accurate information when we do. Another point that I just wanted to make was that with the rollout of PrEP, that is going to be the biggest piece of this, I believe, for mitigation of the disease. Once we can get that out and we can, vaccinate as many people as we can, especially those high-risk individuals, we can get ahead of this. So, you're welcome.
Make sure the board gets communications.
Yes.
Thank you.
Yes.
And there's also one other thing, I'm sorry.
Sure.
There's also a healthcare providers meeting. I'm not sure if you are attending those on a monthly basis that the state has, and that would be a really good opportunity to hear the latest updates. And that's tomorrow at noon, I believe. I can send you the link for
That'd be
that.
great. Thank you.
Sure.
Thank you. Any other questions? Yes, Jeff?
Just operationally,
Sure.
refrigeration, is it the same issue? It's an easier vaccine to transport?
I'm sorry, I didn't hear the first part.
Refrigeration.
It's pretty standard.
It's not like COVID.
Yeah, no, it's not. No, it's not. It's just a cold chain, refrigeration
Oh.
to transport it. Mhm.
And two is how to do the fifth. Do you have it, how are you splitting the dose? You're going to be expected to have a big vial and you draw 5 doses out of it, or how do you split it?
We're going to have some training that's coming up. Dartmouth actually has an echo series that's coming up, and I can forward you that as well. So that we'll, all be on the same page with that. I think it starts next week. I will, or maybe the end of this week. I'll send it.
Any other questions? Seeing none, thank you, Kim, thank you, Lindsay.
Thank you.
Appreciate it. I know this is fluid and changing, and thank you for giving us the most updated version, which is probably out of date already. Next, what I'd like to do is move on to the director's report. Bobby, please.
All right, thank you, Dr. Sturris. So Bobby Bagley, Director of the Division of Public Health and Community Services. I'll first read our mission. Our mission is to promote, protect, and preserve the health and the well-being of our greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values of integrity, leadership, adaptability, and respect. And in accordance with these values that we subscribe to, our goal with this meeting is to make sure that we conduct it in a way that's with the expectation of respect to be shown to all of our staff, our members, and our Board of Health, and to the public. And we anticipate that all the comments that we make during our meeting will be delivered in a civil manner, and will be on topic with the agenda items. With that said, from the report that I have here, just operationally, we continue to support our staff in a collaborative way with our community partners to continue to perform all the functions that are required of us as a public health department, and to make sure that we deliver the services to accomplish the vision and the mission that we have as well. We have begun our reaccreditation process, and we've been doing this for the past several months. Our reaccreditation coordinator and co-coordinator have been guiding us through this process, and we've made some progress with a number of the domains with our work groups and with our domain captains. And so that's good news. We're on target. We're expecting to have our draft completed by the middle of August, so that we can look at getting some of our domains out and reviewed by some of our reviewers. I have a potential reviewer sitting on my right. I'm hoping will agree to review some of our domains with us. We'll be reaching out to you, Stephanie, and possibly other members of our board as well.
My pleasure, my honor.
The actual accreditation report is due by October, so we're pacing ourselves out to have as much as we can have done by the middle of this month, and then the final draft by the middle of September before we have to submit this. We are continually doing work around COVID as well, because as you have heard from the report, COVID's not gone. We're adjusting to how we respond to what we're seeing right now. Lindsay just gave us the report on that. Our team continually has our weekly incident response team meetings to maintain the updates on that, as well as our joint partner calls that happen every other week with our hospitals and our community-based partners as well. Let's see here. And then, of course, the monkeypox meetings, they occur weekly, and it sounds like we're having at least maybe 2 meetings a week now. We just had one today with the update on the HON that will be coming out. One of the things that we are working on with regards to our region is that right now, our health department staff, our public health nurses, our epidemiologists have been working with the state and have been doing interviews and responding to contacts or cases that we've had in the greater Nashua region. We're hoping to engage some of our other community partners as well to be prepared to administer vaccinations, as well as doing some of the other components of this work. And so we do have a meeting scheduled at the end of this week with some of our community partners to discuss that further. As far as a financial update, our CDC Cooperative Workforce Funding grant was approved at the Governors and Council on August 3rd, so we're just waiting for that to be signed and sent back to us. That gives us the funding that supports our public health equity officer position, as well as to support 2 student interns and actually pay for them to be with us at the health department. We also received $10,000 from the New Hampshire Charitable Foundation to continue our substance misuse activities. We had 2 legislative things on the agenda for the city. Our 22023 went to the Personnel Administrative Affairs Committee to vote on final passage of updated environmental health food service fees that we presented before you all, and Heidi will probably talk a little bit more about that. And then we also put forth a resolution 22053 to transfer a little over $34,000 from our welfare administration to our other departments to increase salaries for our staff in community health, in welfare, and environmental health. So we're hoping that it goes to Budget Committee, and we should be at that committee meeting on August 22nd. So we're hoping that that will pass for us as well. As far as some of the activities from community services, our FEP coordinator and FAC coordinator continue to work with our partners on our inventory of supplies, as well as with our emergency management directors and health officers in the region. Many of us attended the public health conference that was back in June, and 3 of us are planners or were planners on that. That was a really good conference. We learned a lot of good information there. We've completed our PMQI training and assessment and our public health core competencies. Both of these assessments are part of our accreditation, so we've gotten that data collected to write that part of our workforce development plan. And what else did they have here? That was in June. In July, there was a lot of work that was done in response to extreme heat, as you can all see in August as well. So we continue with this heat. We've worked with our emergency management coordinator, as well as with other community providers, to make sure not only was information put out, but that water was also supplied in the community as well. Staff is also working on doing mental health first aid trainings, and there's one that's scheduled for this week for volunteers that work with us in the community. Our Medical Reserve Corps volunteers have been invited to participate in that training. We have, we've done a joint promotion campaign with St. Joe's Southern and Dartmouth on chronic disease, and so our goal is to get people back to making their primary care appointments with their docs, also making sure that they get their screening done so that we can start having an impact on chronic disease, because COVID did create a situation where people weren't going to their doctors, weren't getting their annual checkups done, and so that collaboration allowed for us to get some information out, health promotion around those things. We also submitted some abstracts for the American Public Health Association, and that annual meeting is in October, and we have 3 abstracts that were submitted, accepted, so there'll be 3 of our staff presenting at that conference. And then we continue the migration of our community health assessment and our community health improvement plan onto a new platform. We had live stories, so that when you go on our website right now, that platform that you see with all that data and that information is on live stories. They have since ended their contract, and so we have to migrate that information over to another platform, which is My Silo, which we're working on right now. The other last few points, we've had some staffing updates. Kim will give an update on staffing in the community health department. Mara Lassard, who was our public health program assistant, has taken a position in community health, so she's their new administrative assistant there. And we've been working on workforce development. We've had a number of trainings, as you can see in the report, and we've had 4 staff complete the diversity and cultural train-the-trainer workshop. So we're really excited that that was done, so we can provide some of these trainings in the community coming soon. We still have 2 students, high school students, that are completing their summer internship with us, and they'll be finished next week. And the medical student and public health student, they finished their rotations at the beginning of August. And that's it. The only other highlights that I had here, Lisa Vasquez was recognized for her nomination for NAMI for Mental Health Professional for 2022. And Jane Goodman was appointed to the chair of the Awareness and Legislative Work Group for Vaxwell for a statewide coalition to increase immunization rates. And Chuck and I, Dr. Capetta and I attended a conference in Grand Rapids, Michigan, so I'm going to let him talk about that at the end, Dr. Sturz.
Thank you.
And that's my report.
Thank you very
Any
much, Bobby.
questions?
Questions or comments? Stephanie, Stephanie?
The heat response. The notices were great, and it's great that you had some things to give out. I heard today that they said next year is going to be hotter. I don't even want to think about it. But did you have enough resources? Do you have enough resources for the rest of the summer? And is that something that was taken into budgeting before we realized what was going to be?
So the supplies that we used, or the water that we distributed in the community, was not something that was budgeted, but we do have a line that we can draw down from, a miscellaneous line for that. We have distributed water in the community in the past when we've had these high heat days. And so we were typically prepared for that in that sense. The way that these heat advisory will work is that they come out based on the weathering organization that pushed that information out. And we work in collaboration with our Office of Emergency Management and our Public Health Emergency Preparedness Coordinator, who monitors and gives us the information on a regular basis. If it gets hotter next year, it may be hotter longer. That's something that we'll anticipate and then make sure that we can budget for that. The state is, or does have a committee that focuses on what's happening with climate changes in the state of New Hampshire. I sit on that committee, and we'll just continue to engage, and there are different strategies that they have for the state to focus on. They've actually included us in a RFP that they responded to, that they get funded. Then we'll know what more we'll be able to prepare for in the greater Nashua region once we get that information.
Great, thank you.
Any other questions? Seeing none. Move forward to community health. Kim, please.
Sure. Thank you. All right, so I'm going to be reporting out on June and July for Community Health Department. So as far as communicable disease goes, an update on COVID. I won't repeat anything that Lindsay had already spoken to, but we have discontinued our weekly targeted outreach, but we continue to provide education and vaccinations at clinic, and we also perform routine outreach in the community. So back when, in the height of the pandemic, we were doing targeted outreach every week. So we've started to kind of roll that into our regular outreach services. We've had staff in servicing surrounding young pediatric COVID vaccine and our strategy to provide to vulnerable populations. Availability began in our clinics on July 5th, and we are currently providing vaccines to all eligible individuals 6 months and older. As far as monkeypox goes, Lindsay had mentioned how many cases that we've had. We continue to do disease investigation and contact monitoring for the cases that are in Nashua. And as I mentioned, we are providing pre-exposure prophylaxis or PEP. Post-exposure prophylaxis or PEP vaccinations to the greater Nashua regional uninsured and underinsured individuals. Our capability to test in the clinic with specimens is there, and we can send those out to the state lab. We would see clients during our sexual wellness clinics, and we are continuing to attend meetings with DHHS regarding mitigation strategy. And we already touched upon the EUAs. Sexual wellness, another program. This is a new branding. We've moved away from the STD HIV/HCV clinic, and we're rebranding as a sexual wellness clinic. We'll be pushing out messaging surrounding that. We celebrated and supported Pride Month. We participated in the Pride event, which was Saturday, June 25th, and also HIV Day, which was Monday, 6/27. We were able during those two events to test 36 individuals, and we reached over 300 individuals at those events. We received our standing orders for HIV PrEP, and we plan to roll this service out very soon. So we'll have some more information on that coming out soon. Our immunization program, we have planned additional summer immunization clinics for back to school. We are holding them Wednesdays, 4 to 7 in both August and September, and we have pushed out information surrounding those to the Nashua School District, and all of our flu clinics for the Nashua School District are confirmed for September and October. As far as legislation goes, you may be aware that House Bill 1606 was signed by Governor Sununu on 6/24, and that makes the state vaccine registry opt-in. It's currently an opt-out currently, and I believe that goes into effect the end of this month. So we will be working on, along with DHHS, working on how we will integrate that into our process. Strategic planning, we continue to work on reaccreditation and CHIP with our team. Staffing updates, we've onboarded a few high school volunteers. As Bobby mentioned, our administrative assistant 3 position was open. Our last administrative assistant moved away on us, so we have filled that internally as of Monday with Mara Lassard, and we're very happy she's with us. Currently, we have 2 vacant RN positions, one a part-time and one a full-time. Workforce development, staff completed annual department-specific competency day training. 2 of our nurses attended an HIV prep conference in New Orleans. We've been doing ongoing staff education surrounding monkeypox, TB, COVID vaccine for under 5, prep for HIV, QI, and behavioral health topics. And we also had our 4th quarter community health team building day. I've listed other outreach and presentations that have gone on in the notes, just to highlight a few. Nashua Summer Kickoff was Saturday, 6/18 at Greeley Park, and we attended promoting services and resources. We were able to have an educational session at Nashua High South with the outreach van, and that went really well. We have purchased a trailer hookup for our mobile health van. We've had community health workers, as Bobby had mentioned, with the heat, distributing water, education, and cooling center information during our heat advisories. We've participated, a lot of our staff in community health participated in coordinating and serving as camp counselors at the camp that was held for, it was a nursing and health sciences camp at Arlington Street Community Center in conjunction with New Hampshire AHEC. That went great. I think we had 15 campers. It went really well from all different interests, which was great. Some want to be nurses, some want to be doctors. Flavia Martin and myself presented a public health presentation to the UNE medical students at Southern. That went very well as well. And I was also on the United Way Community Connection shows on WMSN discussing public health services. And that's all I have, if you have any questions.
Thank you, Kim. Any questions? Dr. Chuck?
Oh, thank you. So can you just 2 seconds just say why you changed from sexual to sexual wellness from the STD? Because
Sure.
for me, it's a nice time when I say STIs, I can specifically say, This implies to me that the teenagers that we see, and maybe older people, will think this as a family planning clinic or a place to get birth control or ED pill or something.
Sure.
That doesn't really meet the needs of what we really going after.
Sure. Part of the reasoning why we wanted to change the name was to make it less stigma surrounding it. So that was one of the reasons. We do realize that that it does, that a sexual wellness clinic can have a lot of other services. So we can refer out if that is the, if that's the concern. But the way that we're pushing it out, we will make note of that and make sure that people understand the services that we have. It's actually on our website already, the services that we have, and then, of course, we can refer out for different services like birth control and so forth. So.
Would you be able to share with the PC primary care practices what's going on so that we can
Sure.
put
Yeah.
some new
Absolutely.
logos up in there?
Sure. What's the best route for those updates? Because sometimes we find that they may go to the wrong folks. Like, should we be sending them to the coordinators, or should we be sending them to the actual physicians?
Well, it depends on the practice. It depends on the, if it's the adult care, I don't know, I can't speak for them, but for primary care, for pediatrics, I think, within Dartmouth, I can say, if you send it to me, and then I send it around through the primary care groups, because
Okay.
the other two departments, family practice and internal medicine. But some may ask the health person in their office or just the manager to do it too. So I think sorry, I'm waffling, but I think it just.
No, that's okay. I just wanted some guidance on it. Yes.
Yeah.
I think I would just ask the different providers how they prefer
Yes, yeah.
to do it, or the different managers, and just say, who can we send this to? Who's the contact person that best can disseminate this information?
Yeah,
Be
we've
different.
tried.
You
So,
tried that one?
we have tried.
That was the only logical thing I could do.
Yeah,
I'll go down
was
the
just
lines.
wondering,
Yeah.
what.
And they do actually have a person that's like Nicole there, so it might
It might be
helpful if we
the,
can
that
get
might be the
from
best
Nicole, yeah,
route.
from our health promotion person to Dartmouth's health promotion. Her name is Nicole.
Oh, that's easy then.
Yeah.
Yeah, maybe
So-
that route
Yeah.
might be best. So I'll try that. I just wanted some.
And Nicole
yeah.
has her contact.
Perfect. Thank you.
Thank you.
I'd like to thank you for the van going to the high school. We discussed that at our end of the year meeting amongst the stakeholders, providers of the educational programs at the high school. Unfortunately, the person who may have been your contact retired this year, so it may be a new person, but I'd like to see that as kind of an annual event. I think the best time is more at the beginning of the year, only because then we can excite them to get into the right programs to go into nursing. At the end of the year, it may be too late for the seniors, but maybe we can catch some juniors. But anyway, everybody said it was great. I wasn't able to attend, but thank you very much.
Sure. Yeah, we're happy to do that. And we'll definitely be back.
Okay.
Yeah.
All right. I will contact, we'll have a kickoff ceremony in next month, September already. And I'll make sure that they contact you to give plenty of lead time, et cetera.
Perfect. Thank you.
Again, thank you very much. Any other questions, comments? Okay, I'd like to move on, please. Heidi, are you going to do environmental for us, please?
I certainly am.
Thank you, ma'am.
Heidi Pete-Kokoka, Health Officer for the City of Nashua. I have in front of me July's report, but I can talk in general terms about what we did in June as well. And our food service inspections are running pretty normal. We're seeing that our failure rate has kind of leveled out, which is nice. We see people still impacted by the same things in food service that we've been concerned about, but a lot of them are really trying very hard to meet the challenges in today's market. And it's nice to see that there were no emergency responses and no license suspensions. Let's see, and then septic is ramping up, as you would expect this time of year. It has remained pretty steady. Complaints, it's actually been fairly quiet. I shouldn't say that out loud, but we'll take it. And we're trying to get all of our pool inspections completed. Today, the environmental health specialists went out and sampled pools, so Ren is running those samples. So we'll see how those turn out. But that's another market that has been impacted by changes in pricing from chlorine to staffing certainly as well. So we're seeing that just across the board with our businesses generally. And one thing that is not on here, and I'm trying to figure out the date, we did have a positive raccoon that we did not handle, and I think it was on last month's report. But I need to check and verify and make sure that that's recorded. And because there's a reference on here to an incident response team effort that we all talked about it and did some things. So I'll talk about that a little bit. So if necessary, I will adjust the documents so that they live on accurately. But I'm pretty sure it was just one of those really fast-paced things that I'm not sure exactly what the date was.
Was that in Nashua, Heidi?
It was in Nashua. I'll just go into the circumstances right now. It was a Massachusetts resident who observed a raccoon being hit by a car. So he offered assistance to the raccoon and tried to find medical assistance, thinking that a veterinarian would be able to assist. And eventually, Fish and Game came down and euthanized the raccoon, and it was tested positive for rabies. So with the help of the nurses, who were awesome and great in assisting, they worked the human angle of it, and we also, because it's cross-border, one of the nurses was in contact with Massachusetts Epi, and there were two people who potentially had contact. One opted for prophylaxis and not sure about the other person who claimed that she was not actually scratched. So it was pretty interesting, but I think we worked well together as a team. And I think that it was a good opportunity to look at our protocol for specific to the animal portion of rabies. And so that is under revision and just needs a few tweaks, and we're ready to go, and so that will be updated. This is the time of year that we list all of our revenues, because the pools and the solid waste haulers are both come in at different times a year. They are not all the time throughout the year. So we're able to take a look at that. And one of the things that we've benefited from through COVID is that FDA has offered a lot of the really complex trainings free of charge electronically. So we've benefited from that. The most recent one was a special processes course, and they're pretty intense, and they do not want you away from your camera or away from their presentations for other than a break. So, but it's really an awesome opportunity for us. The fees, I can actually update what has happened with that, and I'd like to thank the board and the sponsors for their support in helping us to update our food service fees. They went before the Board of Aldermen and were approved last night. So we're now transitioning to these new fees. We're working on some forms, updating them, trying to get some internal processes, and so we're moving towards implementation now. Ren had an interesting experience with our director, where he was asked by Fire Rescue, or actually Bobby was asked by Fire Rescue to respond to unsanitary living conditions in a single-family home. And gentleman was removed for medical reasons. And what has happened because of this, and this is the situation for this person, is actually working out pretty well. He is no longer able to remain in his home and care for himself adequately. So we're working very closely with Bureau of Elderly and Adult Services and the St. Joe's social worker as well. So for that specific situation, it's working out pretty well. But we had another conversation with the fire department, fire marshal, and building department to talk about how we can address these in real time in the field as well. And part of it stems from collecting good documentation of the circumstances in the field, and then working more closely together. So we're on to something. And then, let's see, we have begun mosquito testing in Nashua. That was earlier this month. And considering the drought conditions, I think that we may go by unscathed with, because the mosquito population is not what it normally is. Excuse me. And then Ren put together successfully Domain 6 for accreditation, and we're staying busy with that as well. I've got to drink some water. Sorry about that. Better?
You all set?
Yeah.
Oh, sorry. Any questions? Stephanie?
The department has done such a great job of coordinating responses, as is in the mission. Meals on Wheels often will have access to individuals on a
Yes.
daily basis, and especially during the pandemic, has acted as their only contact with the outside world. Will your coordinated response about individuals living in unsuitable conditions also include community partners such as Southern New Hampshire Services, so that everybody's on the same page and using the same approach and contacting the same people so that people get what they need in a timely fashion?
We used to.
Yeah.
And that information is critical, and I know from working on housing cases over the years that just that the eyes on a situation is really a big piece of this. I have dated history with some of these circumstances. There used to be more of a collaborative effort among the social service agencies with Bureau of Elderly and Adult Services, the police department, et cetera. It happens, but it's not as coordinated as it used to be. Bobby and I have discussed this, and we would like to see something like that come up again so that we have all those players forming that safety net for vulnerable people. Thank you.
Any other questions? I'd like to compliment you on the grass. I'd like to give credit where it's due. Got back, set the stage for color grass.
I haven't done pictures in a long time.
Ooh, the competition heats up.
Mine are black and white. You get the color ones.
Thank you. Bob, would you like to?
Oh, it's my turn. Okay, great. Thank you. Good afternoon. Bob Mack, Welfare Officer for the City of Nashua. I will be reporting out on the June and July reports for the Welfare Department. If you look at the June report, I mean, fairly straightforward, no big changes. We continue to work with the homeless population, with our partner agencies to try to get people connected to appropriate resources, continuing to see people getting assistance from the Emergency Rental Assistance Program at Southern New Hampshire Services, which has reduced our need to expend a great deal of the general assistance funds. If you look at the June report, you'll notice we spent approximately 56% of our budget for general assistance for the last fiscal year. That was adjusted a little bit at the end of the year. There were some carryover vouchers, but it's right around 56, 57%. And so that moving into the beginning of this fiscal year, we've spent about 1.5% of our budget so far for this year, so that's 1 month, which again includes, we continue to work with our partners. We evaluate the need for collaborative assistance and supplemental assistance, if you will, because often agencies can't provide the entire amount of assistance that some of these households need. So if we can provide some and another organization can provide some, we'll partner in that way to make sure that the needs are met. Even with those partnerships, though, some folks still experience evictions and homelessness. So we continue to work with our shelter partners and rapid rehousing partners as well. It's interesting to note when you talk about some of these living conditions, one of the things that has been noted with our outreach teams and our shelter partners is they're seeing an increase in, it's an older population that's coming into some of their programs. And with that, they're finding that their shelter guests have more needs, medical needs. And so out of that, through the COC, Greater Nashua Continuum of Care, a healthcare coordination subcommittee was formed to work with some of the hospital partners and providers, along with the outreach teams and shelter providers, to try to coordinate some of those services to make sure that while they're in these shelter programs, they're still getting some of those home-based services. And we can also work to coordinate that as needed if we have people temporarily in motel placements. So one of the other reasons that's important is when you mention elderly and adult services, they are experiencing a significant shortage in staffing, frankly, and have had some challenges being able to respond to some of the reports. They've had to, I think, prioritize some of the real urgent cases, which is not always a good thing, but it's they continue to evaluate and do as they can, and that's all the more reason for community partnerships, why those are so important, so that if reports come up, if there's some other response that can be done, we can do that together. Director Bagley had mentioned some of the legislation that was proposed, shift from some funding from the Welfare Administration budget. That's basically coming from a vacant case technician position, which we will not be filling for this fiscal year. Part of that is around the salary adjustments as we look to reclassify some of these existing positions, enhance some of the duties that they've been providing, and that frankly really came to light through the whole COVID situation, that they were spending a lot more time doing case management and trying to connect to resources, particularly when it was challenging to access some of those resources. So we're kind of enhancing that and taking a look at that so that as our numbers have gone down a little bit during the pandemic, because of some of these other programs, we'll continue to monitor that and provide appropriate services accordingly. There were some extensions on some of those emergency assistance programs, so there was some additional funding that was infused into that. We still don't know exactly how long it's going to last, but New Hampshire Housing Finance Authority, which manages that program, has told us they'll keep us informed as to how those things will wind down, when and how they will wind down. I think that about covers everything. I don't know if there are any questions.
Any questions for Mr. Mack? Seeing none, he gets off lightly.
Thank you.
Thank you, Bob. I think we have just one other thing to do. You and Chuck are going up on stage. Something like that. Who wants to be first?
No.
Chuck can go first. He had such a good time. I want him to share.
So we had the pleasure, thanks to our wonderful chairperson and his discretionary funds, to go out to Grand Rapids, Michigan, last Tuesday and Wednesday to attend the National Association of Local Boards of Health group. And it was about 85 participants with keynote speakers on each day, and then breakout sessions in the morning and afternoon. So Bobby and I, we could go today, would have been done by now, but we went from 10:30 to 11:30 last week. We had about 20 people in the audience. And our presentation was our response and during COVID and the mask discussion and how we worked it through the legislation and all the things we all lived with. So it was my first opportunity to be in that kind of setting. Bobby's a seasoned veteran, but I found the groups were very, it was fun to see. We had a lot of discussion after each of the seminars about the size of board that came up in our group. We tend to be the smallest group of 3 Board of Health people. There was ranging from 6 to 12 in some of the bigger places. And with obviously the pros and cons that we've addressed here. So we didn't do too much on that discussion, but it was interesting to see the size, the same things around COVID, the reality that public health is now, which had been hidden in the dark ages for so long, thanks to COVID, the only thing we can say, was positive maybe, but that now public health departments across the country have been now seen as the go-to people and the resource people and the education people and all those things that you guys do every day, we take for granted. I think your time has come, and it was fun to, salute to all of you, the worker bees that do this every day. And it was really palpable, that sort of energy, and say, we're not going backwards. As Bobby said, the stone's been turned. We're front and center now, and let's go forth. So it was great, apart from the travel. Grand Rapids, Michigan, you could eat off the streets. It was absolutely beautiful. But to get there from here is, you don't go quietly or shortly. It was taking 8 hours to get there, and then it took another 8+ hours to get home. So, but overall, it was a great chance to kind of celebrate, what you guys have done as together, and the political landscape and all that stuff is the same thing. We're short of funds, short of support, but it was fun. And the highlight was Tuesday night after dinner. Thank you for the money. I had nice seafood, thank you. Bobby and I just happened upon, in the center of town, about 200+ high school kids that looked like something out of the movie from Greece. Were just doing all these choreographed line dancing. One was a Polish line dance about a big 360 circumference open stadium area. And they were taught by some band member to what to do, gave 5 minutes of instructions, and then they all divvied up, and they did their steps forward, they did their steps back, they did a twist, they did a hop, and then everyone would inch forward. And so if Tony and I were together, we'd start together, but then after the hip and the hop and the twist, I would be with the person behind you. And so it proceeded that way, and so I wouldn't see Tony again until the 360-degree dance was over. It was really fascinating. And then they went to Neil Diamond and Sweet Caroline, and they were just doing as I said to Steph yesterday by text, I said, it was like something out of, the Happy Days. I was just expecting the Fonz to come, because they had bobby socks, they were just doing their shoulder routines and, all this stuff. At some point I just turned around and said to this wonderful teenager, what the heck is going on here? And I'm from Boston. I've never seen anything like this. And it was just very delightful. He said, this goes on every Tuesday. He was sweating bullets, and then he just grabbed his partner and ran back onto when the next dance come. So it was just a great opportunity to have some actually real energy and real fun around some stuff. So I would recommend Grand Rapids in a heartbeat, but maybe just drive. Don't fly. But thank you very much for letting me go.
Yeah, no, I see, you can see that Chuck had fun while he was there.
We don't let Chuck out now.
Exactly. Did a great job with the presentation as well. We had folks that came up afterwards to ask him lots of questions about our process and the things that we did here, working with our board, working with our Board of Aldermen, the public meetings, you all lived through it, and it was interesting to share, what happened here and to learn about what other states had gone through as well. I mean, across the U.S., the public health departments and the infrastructures are so different. It is amazing. And so it was really good to hear about some of the other health departments and how their boards work. One of the things that Chuck and I also talked about was the fact that this is a great opportunity for our board members to go every year. And so for next year, who knows what we'll submit, but it's a good opportunity for the other, and maybe the three of you go together. But it's a good learning opportunity and a good opportunity to share. So we were very much encouraged by that as well. We met Kay Bender. So Kay Bender was the executive director over the FAB board, our Public Health Advisory Board. So she remembers our tiny little state getting accredited. And so she was like, yes, as Bobby and I were talking, so this is how small the world is, right? So first name basis. But it was a good experience and a good opportunity to share the hard work and the impact that happened here in Nashua with some of our other local boards of health in other states, so it was really good. So thank you, Dr. Sturris, for agreeing
Money
to
well
that.
spent.
Yeah.
Chuck, are you going to share that video?
I can, but
No, not the first one, second one.
the second one, oh. Bobby,
Actually, it's a good video.
Bobby has it on her
Yeah.
phone,
Yeah.
so maybe at a department meeting, then invite me, and you and I can practice beforehand, and we'll start to do this. I don't know if you've ever done Polish line dancing, but that is really
No.
hysterical.
It's on the bucket list, Mike.
Yeah, it's very easy to learn.
Yeah.
Yeah, so I have shown it to some of the directors here in the city of Nashua. I am hoping that we do something
Might be nice.
at the city.
I told my
In the
mother, and
city.
my mother's Swedish, my dad's Italian, so as soon as I called her the next day, they live in Florida now with my parents, and she said, "Oh, that's so familiar to the Swedish line dance." I mean, every country, I guess, the background, they accepted different maneuvers, so I was FaceTiming her, so she remembers it growing up in Sweden and visiting her relatives, that I said, "Well, Mom, you would have done great," so there's probably a similar dance for every country. This one was just Polish that night.
Yeah.
We aren't done yet. We have a member of the public here.
Hi.
Speaking, not speaking.
Do you want to introduce yourself, please?
Absolutely. Wherever you're comfortable.
My name is Tricia Owens. I was actually invited here by Gloria. I am a Litchfield resident, fairly new transplant to New Hampshire. I am a registered nurse in the state of Massachusetts because I sort of switched paths and have been out of nursing practice. I was not able to get a license in New Hampshire. At 50, I went back to school to become a psychiatric nurse practitioner at MGH. However, after starting the program and recognizing that most of my time would be spent writing scripts, I decided, with great trepidation, because I very much identify as a nurse, to switch paths and become a licensed clinical mental health counselor. Because of my sort of foundation in the belief of wellness and the role of medication as, particularly in mental health, as sort of avoiding dealing with the underlying issue, which I also think happens in physical health as well, but that's a whole nother subject. And so my background in nursing was in pediatrics, in outpatient. It's always been focused on prevention and proactive care. I developed a support group and a game for helping kids understand asthma and asthma triggers, and parents to understand how to be proactive. I've been an allergy nurse. I was a community health nurse doing occupational health and flu clinics and health counseling. And a psychiatric nurse at Franciscan Children's in their locked unit. So I went back to school at 50 at Antioch, right here in New Hampshire, and graduated in 2013, worked in community mental health to get my hours and license, and then opened up a private practice here in Nashua, which was actually in Hudson originally, but now I've been in Nashua for 3 years. And the name of my business is Grow Your Own Way Counseling Services. It's just actually me, but I work with, I sort of have a subspecialty in working with people on the autism spectrum, high functioning in particular. I do some advocacy work with the schools to help these kids that fall through the cracks because they're high functioning be recognized for the suffering that they're dealing with mentally as a result of how hard it is to perform. And I'm here because after George Floyd's murder, I became a life member of NAACP, as I felt like I needed to make a statement, as I guess small as that was. But through that gesture, I then started to just attend the Zoom meetings as a attendee, kind of like I'm here today. And 2 weeks ago Wednesday, 2 weeks ago today, actually, we had a board meeting, and at the end of the meeting, I just spoke like I am today, and I just introduced myself and said that I have a passion for making change in mental health and with physical health. That's my love, and that if there are any things that NAACP was working on that I could be involved with, please let me know. I'm not quite sure, but I think it was Cindy Burrows that just all of a sudden just nominated me to be the lead of the health committee, which I don't believe existed before at NAACP, and then it was seconded, and then there I was. And I was encouraged to reach out to Bobby Bagley as my sort of first step. So the next morning I went to the office, and being very sort of anxious and green and sort of like not knowing what had just happened to me the night before, I just looked up Bobby and I said, I'm going to do this and pick up the phone and get it over with before I start my day. And wouldn't you know it, as luck would have it, Bobby picked up the phone and said, Bobby Bagley. I'm sure you can attest, Bobby, that I was kind of stuttering, which is not really, typically I'm not lost for words, but I felt really out of my element. And so Bobby was very gracious and welcoming and I said, I'd like to sort of learn about what's going on in the community, what are the needs, and in particular, what's going on with NAACP and what's their alliance and what can we partner about and what are the needs. To which Bobby said, sure, can you come in at 2 o'clock? As I explained to Bobby with, trying to fit it all in and look presentable and, and kind of put myself in a place where I've never been before at 62 years old, I was honored to meet with you and to be so well received in terms of honoring, and sharing the passion that I feel for community health and the importance of it in terms of overall well-being. So that's why I'm here. Gloria, actually, I got a welcome to the executive board message, and there was kind of a back and forth going, and Gloria said, hey, you should try to come to the Board of Health meeting sometime, and so here I am, because when I go in, I'm all in, and I apologize for tarnishing the chair, because this is very unfamiliar to me, so here I am. And I just wanted to make one comment about the change of the name because up to the sexual wellness, because I think that that's, in my practice, it's very important that we talk about, I constantly working on it, that to me it is mental health issues, just like physical health issues. And that's part of, I think, the stigma that we're trying to change. And so in my work, I look at the limbic system, the emotional system, is just another system of the body that we haven't really understood, and that it has its chemicals and its blood flow and all of its parts. And I guess the greatest analogy that I can give, which I use, and people kind of think it's funny, but we don't question when our urinary tract tells us that we need to go to the bathroom. It's a signal that our body gets. And if we don't respond to that in a timely way, eventually it will spill all over us. And that's the same thing that happens with mental health issues, that if we don't know how to respond to anxiety, to anger, to depression, if we weren't taught or modeled, then it takes over, and then it affects us physically as well as mentally. So normalizing that as mental health is a system that we were born with. We just didn't understand it. And with the fMRIs really helping us to see what goes on in the brain, it's really helped over the past couple decades to shift the way people are looking at mental health. And so I understand that it's kind of strange to say sexual wellness, but it's also really important to have that umbrella where we start to think of it as something that we can be mentally healthy or mentally unwell, sexually healthy, sexually unwell. So I appreciate the word change, although I do understand how it does change things.
Oh, no, I get it too. Good point. Thank you.
So that's a very long-winded introduction, but if I'm going to take the mic, I might as well use it. so thank you for that. Welcome.
Thank you for coming.
Thank you.
Any questions?
No, but I have a comment. I just want to let you guys know Nashua go back to school August the 25th, 5 to 6:30 p.m. at your local library, and also the Cultural Connection is September the 17th. I would like to see representation from the health department there. I know you guys gonna be there anyway, but I'm just putting it out there. Those are my 2 comments.
We'll be there. We'll be there. We'll be there.
Good.
Yeah.
Good.
Any other questions or comments? Good jokes, bad jokes, none? Looking for a motion to adjourn?
Yes.
All those in favor? It's unanimous. We are adjourned. Thank you very much.